Is this okay in the back, or you want me to turn it off?
Perfect, perfect. Welcome, guys, welcome. We're just going to give everybody about a minute to get in. I see everybody is coming in slowly but surely, so we'll just give it a few seconds. Awesome. All right. I know a few of you guys are still coming into this webinar. Definitely, make your way in, tell your friends. We're excited to have you guys here today. My name is Ariel Rafua. I work with the Greater Dallas Restaurant Association, and I want to welcome you guys into TRA Marketplace virtual 2020 version. We're super excited to have you guys. And today's session is health inspections and on-site evaluations, the best topic we can possibly talk about. We're excited about it. And also reminding you guys that we do have a Q&A button on the bottom. So throughout this webinar, if you guys have any questions, feel free to type them. We'll try to get to them during it. If it's not answered, we'll get to them at the end 100%. And without further delay, I'd like to introduce to you guys the official sponsor of the Silicon Hills stage is Coca-Cola. Thank you, Coca-Cola Southwest Beverages, for sponsoring this virtual stage of ours. You guys are the best, and we're going to stream a quick video for you guys.
We may be one of the world's most familiar companies, but we make more than our name suggests. We're an organic tea company, a premium juice company, a coconut water company. We've got drinks for long days, for birthdays, for turning over new leaves. And we make them for every moment in every corner of the country. We are the Coca-Cola Company, and we're proud to offer so much more.
Yes, guys, Coca-Cola. Amazing. Go grab one if you guys have one. Thank you so much, Coca-Cola, for sponsoring. And I'd like to introduce to you guys our Chief Strategy and Operations Officer, Joe Monastero, and he will introduce the panel. Thank you, Joe.
Thank you very much, Ariel, and to all of our attendees, welcome. Thank you for joining us again for this education session of the virtual TRA Marketplace 2020. Again, our topic today, health inspections and on-site visits. Clearly a very important topic and one we look forward to diving into and taking your questions on. So first, let's start by introducing the rest of the panel. We have with us today Crystal Jacobs, Vice President and Program Director at Restaurant Guard Insurance, both a provider of comprehensive and customized insurance solutions that includes coverage for contamination and foodborne illnesses. We have Adrian Escobedo, the CEO and owner of Serve A+ Food Safe Inspections, Inc., based out of Addison, Texas. Both an instructor, proctor, and health inspector. He is bilingual, teaches courses, and is the professional health inspector for the arenas, American Airlines Center and Texas Motor Speedway. And finally, rounding out our panel is Chris Gillen, CEO of A Closer Look, which is a customer experience research and mystery shopping company, currently working with us here at the TRA as part of the Texas Restaurant Promise certification program. They are the ones who are doing the on-site inspections to see that everyone is following the Texas Restaurant Promise and reopening protocols and giving that certified and verified seal, as well as the program that allows your customers to text in when they see something's not quite right. Their company works nationwide. And so these three professionals are here with us to talk a little bit more specifically about the things that are happening right now in our industry. So to get started, I just want to lay the groundwork a little bit for this topic. One of the things that we all should be very proud of, and we have been talking quite a lot about in Texas on behalf of the industry, is that restaurants are by nature sanitation and health experts. We have to be. Ours is one of the most heavily regulated industries from that perspective. In order to open your doors and operate, you have to pass a rigorous health inspection. You have regularly scheduled health inspections, most often surprise ones. You have the state's rules. Many times you have variations of local rules depending on where in Texas you are based. You have the county, you have the city. So bottom line is all of us have a whole lot of rules we have to follow. This pandemic has certainly brought a lot of scrutiny into our industry, and We've spent a lot of time dispelling the oftentimes incorrect statements that somehow going to a restaurant or bar is going to mean you're going to catch COVID, and continually reminding the public of the fact that COVID-19 is not a foodborne illness, and reminding them that it is safe to go into a restaurant and to dine inside of a dining room or eat outside on a patio. And nevertheless, because it is a virus, we have heightened the precautions that are being taken, the additional sanitation steps that are being taken, both to protect our employees and our staff, as well as our customers. And that's really where the Texas Restaurant Promise came from in the first place, was to establish that sort of unwritten contract between our customers, our staff, and our operators. So where the world's going tomorrow is a big theme in the marketplace this year. And that's another topic we want to cover today as well. So I want to kind of kick this off and just ask each of our panelists to just give their initial impression on what COVID has done to the industry from a health and sanitation perspective, and what has kind of impressed them the most in the last 5 months of this incredible pandemic journey. So Crystal, why don't we start with you?
Hi, everybody. Thank you for joining. I think obviously COVID has had a huge impact across the board, but nowhere is that more felt than in the restaurant and hospitality industry. With that, I think it's really, you've almost had to change. It's more than just changing your playbook. It's changing the entire game at the end of the day. And really what I've been impressed with is the industry's adaptability. From going from a situation where you had 100% capacity in your dining rooms to having to go to-go and pick up orders only, to having to reduce your capacities, and just that the industry as a whole has really tried to adapt, and I think has done a great job at it. And of course, we all have a good road ahead of us, and I think the difficulty that we face is more from a reputational standpoint and how it's going to be perceived by the public, what we're doing as restaurants and how we open, and the things that we're doing in the front of the house that, the consumers can actually see. But, definitely adaptability has been the biggest thing I've been impressed with the industry.
That's great. Thank you. Adrian, how about you? What's the thing that's impressed you the most?
Well, I'm impressed now that the restaurants are paying more attention now when it comes to food safety, sanitation. That's another one. Definitely. As an instructor, proctor, and doing inspections too as well, I always talk about the importance of washing your hands, food safety and all that. And for a while, some of them will not pay attention to it, but now everybody is paying attention to it. I know the customers are going to be more picky. You can tell right away. They're going to be more stringent. The cities are going to be more stringent too as well. And it's all about changing bad habits to good habits. And I think it's changing right now as we speak. People are beginning to get trained properly and really pay attention to your food handlers, to your manager certification, the importance of to avoid a foodborne illness in an outbreak. So that's what I'm impressed about now. Lately, they're focusing more on that, because the cities, as I mentioned, and the customers are going to be a little bit tougher too as well. Yes, sir.
Okay, thank you. And Chris, how about you?
Yeah, I would echo exactly what my peers said, but I think two things stand out in my mind. One is health and hygiene is the new net promoter score. It really is, and I think, pre-COVID, when you think back to January and February, it was about service, it was about experience. Not that I think those things are dead at all. I just think the consumer now is really focused on health and hygiene. What are you doing overtly to win my trust back as a consumer? And I think that's the way it's going to be for a while. In terms of what I'm most impressed with, it would be no different than what Crystal and Adrian said, but I would say innovation. I mean, how quickly these businesses were able to adapt and think of new strategies and new ways to stay alive. And look, as a business that 70% of our business is restaurants and hospitality, we were equally as impacted by COVID as everybody else. So we know how important it is to be adaptable, and I'm continually impressed as I see restaurants today just continuing to innovate and survive and try to hunker down and get through this.
Very good. One of the other things I think that needs, or at least worth mentioning, is the fact that when there is a true foodborne illness outbreak, it makes the news. to be fair. And it can make or break the brand reputation of a restaurant. Certainly when it's a large chain. I think we can all remember as far back as even 20 years. So, certain brands that still have that connotation as having made the news when there's been Salmonella, E. coli, or even a botulism outbreak, right? And so with where we're at today and all the attention that has been given towards things like partitions and disposable menus and wearing masks, et cetera, how has this changed that paradigm a little bit in that we haven't heard anything lately about foodborne illness? That's not necessarily a bad thing, because I think restaurants have, as Chris mentioned, had to be extra diligent in sanitation, and just the fact that this is your standard virus gone rogue that the pandemic has brought to us. But at the same time, has it distracted from the day-to-day norms that we're usually watching out for? This has been an incredibly intense 5 months. We've dealt with, beef shortages. We've dealt with, meat prices going crazy. Obviously changing protocols every single day, staff going on furlough, staff coming back. I think suffice it to say, not only have we been the hardest hit industry, we've also faced the ever constant changing paradigm. How we operated our businesses before is certainly not how we're operating them today, but it's not like it just switched once. The rules and the goalposts are moving ever constantly. It's in part why we have our nightly newsletter, because there's so much information to communicate to keep everyone up to date with just what are the rules today and what will they be tomorrow. Quite often those are not the same thing. So I think, Crystal, I'd like to start with you from your business's perspective. Is what is the best advice you can give to the restaurants today who need to remain diligent about all of the things that when you take a class with Adrian, you're learning about and forewarned about and trying to protect your customers from, while at the same time there's this massive global challenge facing us that keeps changing the rules on us every 5 minutes?
Yeah, I mean, it seems like sometimes we're almost in a completely impossible situation, right? The biggest thing that I always try and encourage restaurants to remember is, yeah, COVID is what is obviously the topic right now. I can't even say the hot topic because it's the only topic, it seems like. But that doesn't mean that foodborne illness doesn't exist and isn't out there and isn't happening. It's just not getting the media time that it would under normal circumstances. And so you do have to continue to be diligent about the things that you're doing within your operation. But even outside of that, you can be as diligent as possible, and a foodborne illness can still happen. So make sure that you have protections in place financially, because can you imagine having a foodborne illness outbreak in the midst of all of this that hits your local media? I think what we sometimes forget is how media bans have really changed over the last 20, 30 years. So what normally would have been just a localized event from a foodborne illness perspective is now a national event, simply because we have social media outreach and just the actual media bandwidths have completely changed. So, we, in a COVID situation where national news, that's what's dominating it, I can imagine that if a foodborne illness were to happen to you, it's going to stay localized. But can you imagine that happening to you in a local scenario? Would you be able to actually recover from that? And so I think it's just really important that people are cognitive of that and remember that can always happen. And there are things out there that can help you through the situation and can help protect you financially.
That makes a lot of sense. Chris, a question for you. The work that A Closer Look does and secret shopping, how has it changed, or how is it different from what you would normally do if a restaurant were to come to you from a health and safety sanitation perspective, and the things that are happening right now with COVID? What has shifted? What has changed?
Yeah, well, I think the biggest change is prior to COVID, I don't think many businesses would have come to look at mystery shopping from a health and hygiene perspective. I think it was very much focused on service and operations and things, all important, don't get me wrong, but COVID has put the spotlight on the front of house in terms of, and I mentioned this, look, it's important to have proper back of house protocols and standards. All of that is so important. But at the end of the day, if the consumer walks in to your restaurant and doesn't see the things that they expect, i.e. people wearing masks, cleanliness, those things, you don't even have a chance to show them anything else. And so I think what it's done is it's really highlighted for businesses the importance of making sure that health and hygiene is first and foremost, and that there's consistency, especially those out there with multiple locations across the state or across the nation. Making sure that there's a consistent experience when it comes to health and hygiene protocols has really become the big focus.
Adrian, one of the things that we probably have to always make sure to express is that during this incredibly difficult last 5 months, on the whole, given just how many different bodies of authority there are throughout the state of Texas and the 254 counties and hundreds, if not thousands of municipalities, the various health departments have, again, on the whole, been incredibly cooperative, have reached out to us from the very beginning to collaborate on communication of information, on collaboration as restaurants began to reopen, on alignment with the protocols. But one of the things that was asked of the health departments at the very beginning was also to help a little bit with the enforcement of the reopening protocols. And that was putting an additional burden upon them. And how do you think that impacted them, that their first primary responsibility is to help ensure restaurants are compliant with just the general health code to begin with, and that what they're doing is protecting the public from the real dangers of foodborne illness? And yet here in the midst of this pandemic, they're also being asked to make sure that everyone's being compliant with social distancing and with those partitions and everything else and the PPE that's being used. And as we fast forwarded today, that is not as much the case. In big part, TABC has helped to step in and do a lot of that in the piece of the sector that has higher percentage of alcohol sales and those types of pieces. But nevertheless, the health departments are still being asked to do a lot more than they were before. Are they feeling a bit of the distraction from their core responsibilities at the same time?
Well, they definitely have extra work now. Yes, it is. Your health department, your health inspectors, they also do something else, like, swimming pools. It's another one. They inspect other things besides restaurants. Okay, so now asking for this is really extra for the city. Nonetheless, just remember this: the cities, they want you to succeed. Some people think the health department just wants to close them down, and that's not the way it works. There has to be an imminent threat to begin with. But the city wants you to succeed, because after all, you are paying for a permit. You are paying for a fee, a yearly fee that keeps bringing in money. You're hiring people too. You got a health inspector that gets paid from that too as well. They're there to help you out. Nonetheless, they are enforcing some, they got to take care of the public. That's one of the things. Because at the end, everything has to be documented. Are they getting extra work with this separation, social distance? Absolutely. But I think everybody's just being patient, and everybody's just working together. That's what it is. You got to work together. Work with your city. Your city is not your enemy. As I mentioned, they want you to succeed, because you are paying for a permit. Nonetheless, they do have a responsibility. And the responsibility of the city, the health inspector, they got to take care of the public. That's what they do. They got to take care of them, because after all, got to think about this. Lawsuits will come in. And there's a lawyer, there's an attorney out there who wants to sue the city right away. So that's why everything has to be done properly from the city. And yet it is your responsibility as a restaurant to make sure you get the proper training and follow those procedures. And that's pretty much it that I can talk about.
Fair enough. So one of the things we're going to be talking about today is where we see things going from here. God willing, this pandemic won't last forever. It certainly won't last much longer. And we can look to the future. We can look towards regaining what we once were and getting back to life as normal, or whatever normal will be. As we start talking about that, again, want to remind everyone, you can feel free to send questions in via the chat box or the Q&A button, and we'll be answering those throughout the conversation and at the end as well. To start the conversation on the future and sort of where things go from here, I think one thing everyone can agree on is that the entire COVID-19 pandemic and how it has impacted the world, and specifically how it has impacted our industry, is going to leave some permanent impressions. And I think specifically as it pertains to health and sanitation and the visible attributes that pertain to it in restaurants, where In the past, people went out, and oftentimes it was because they didn't want to have to do the cooking at home, or they didn't want to have to do the dishes at home. I think Chris made a very valid point at the beginning. They are aware now of, is the place I'm going to clean? Is the place I'm going to not just going to give me good food, but a safe environment from a health perspective? And so I think starting to have a conversation about where does that lead us then as operators to think about what long-term permanent changes to our business model does that entail? So Crystal, starting with you, the insurance side of things, sort of the protection side. You can't say that you could protect everything. You can't say you could foresee everything, or we wouldn't need lawyers or insurance. So what do you see as being right now, with your kind of lens tilted towards the future, as being something probably permanent that your company and companies like yours would play a role in?
Well, I think really, as a whole, we all have to think about our insurance differently than we have in the past. So it's so easy, and I know I'm guilty of it on my personal insurance, is allowing those auto renewals to just go through. Every year it just renews. We just pay the bill. We don't have to worry about it. We don't got to touch it. Just let it go. And we really have to get out of that habit and understand and be willing to think outside the box and think more broadly about what our exposures might be. It's unfortunate that one of the most common responses I get as far as why people haven't purchased a coverage that specifically addresses communicable disease outbreaks from a business interruption perspective is that it's never happened to them. And I think we have to get out of that mindset. The future is that we have to get out of that mindset. We have to be willing to decide, what is our business worth? What are the things that, while, yeah, it might not have happened to me yet, it potentially could. I think the CDC says there's nearly 50 million foodborne illness or reports of foodborne illness in the US every year, nearly 50 million. That's a lot of opportunity for your restaurant to be involved. And it's also one thing that if your restaurant might be, you have great procedures in place and stuff, but if you share a brand with somebody else and they're down the road and they maybe don't have the best procedures in place and aren't operating to the standards they should be, and they have an event, there's a brand impact there that you have to think about. So it's, for me, the future is about making sure that we are taking a step back and saying, have we really thought this through? Is a $1,000 a year policy worth my business, right? If that's going to provide me with business interruption, if I have a salmonella outbreak, that's $1,000 a year. That breaks down to something like $2.74 a day. You throw away more scrap in a day than that. And so it's really having to break things down on that level and say, what is my business worth? What am I willing to invest to make sure that I'm protected at the end of the day? Because if people have been willing to do that before, there potentially were protections in place for COVID business interruption. That's the reality. So it's really needing to, in the future, open up and be willing to have those hard conversations.
Makes a lot of sense. Adrian, what about you? What do you think is going to be the long-lasting remaining piece of this?
Well, as Crystal was saying, and I totally agree. I always mention this whenever I'm doing the classes. I always mention, you have to understand that customers are going to vote for you with their money, because you're not the only Mexican restaurant, you're not the only hamburger place, you're not the only Italian restaurant. You get them sick, they'll stop eating at that Italian restaurant, but they're still going to eat Italian food. You have options. I always mention that. Taking this Ms. Crystal was saying too as well, people do die. People do die a year. Over 3,000 people die because of a foodborne illness. You have to change bad habits. That's what it is. Look, I'm going to bring in the American Airlines Center. It's a big venue. I'm not talking about a large restaurant with one kitchen. I'm talking about 7 large kitchens, concession stands, bars. And even though we just broke bad habits when I started working in there, we all contribute. We work as a whole. But it's just about breaking bad habits into good habits. That's what it is. And after all, with this score 99, 99, and 98 with the city back in February, it's almost perfect. Now, It has an effect in the business. Absolutely. It has an effect in the customer first. It's a human being. And then it has an effect too in the business too as well. There goes your investment. And Ms. Crystal was saying, some people wait on these things. Don't wait till, and then it happens, and then you correct and everything. Because look, it happened at Chipotle. I hate to bring in Chipotle in this situation about 5 years ago. They went through it, and it went national. It didn't even happen in Texas. It happened in Seattle, Washington, somewhere in Washington, another one in New England. But now the safest place that you can go eat is Chipotle. They do everything correctly now. They'll do everything correct. Why do you have to wait for something that happens and then you correct everything? Just follow the rules. It's for your own, it's for the benefit of the customers and your business too as well. That's my opinion.
No, it's absolutely fair assessment. Chris, what about your thoughts?
Well, this is about rebuilding trust with your customer. And I think this is, everybody has to look at it this way. When the middle of March rolled around, everybody lost their customer, and no fault of your own. It's what happened. And the consumer, and I know this because we talk to lots and lots of consumers across many different industries today, are rethinking where they want to go spend their money and their time, and what's safe and what isn't, and who they trust. And so I encourage you, because I don't think this is going to go away quickly. Even if there is a vaccine, I think it's forever altered the way the consumer thinks about business. And I think it's important to what Crystal and Adrian said, for all of you to think about both what you're doing behind the scenes and the importance of that, but more importantly, what are you doing overtly to let your customer know this is a safe place, you can trust us, feel comfortable coming back and dining inside the restaurant. Takeout is great, and all these curbside alcohol sales, I love them. But we got to get people back in the restaurant if we're going to survive. And the only way to do that is to rebuild trust with the consumer.
Absolutely. We did have a couple questions come in, so we'll take care of these, and then we'll get back to a couple other thoughts. Para has asked, when your restaurant is open, and you normally have people placing their orders up at the bar, if you've got a partition up, can you have them order and take their drinks from the bar back to their own tables, or do you need to serve them? Basically, here's, as of the last round of adjustments to the reopening protocols, the way that you can do it is this. At the very least, you have to have the minimum 6-foot distance between the bartender and the customer. So if you've got a plexiglass divider up, that's even better. A few of the places that I've been to that have a similar ordering process in place, that is exactly what they have done. You also have to make sure that any line that someone is waiting to place their order has markers on the floor for social distancing in place. Have them come up, place their order. Yes, you can give them their drinks, and then they take it back to their table. They, of course, have to be wearing masks the entire time that they're waiting in line, placing the order, taking their drinks back to their table, and don't take their masks off until they've sat down at their table. And then you either deliver their food to their table, or they can put their mask back on, come back up to the bar to pick up their food and take it down. Some of the best examples that I have seen of this are the places that have actually marked on the floor with some great logoed stickers, the pathway for you to walk. Great shout out to our friends at Easy Tiger here in Austin, their backyard patio. It is almost like you're playing an adult-sized version of Candyland, following the dots along to go to the bar, place your order, take your drinks, go sit down at one of the patio tables, and then to go back through to pick up your food when it's ready. Yes, you can do that. But again, you've got to make sure you're adhering to all the social distancing rules. One of the other questions that has come in, Crystal, for you, since the pandemic started, have you seen a surge in customers that previously didn't have coverage that are now saying, what, maybe this is something that I do need to think about and are coming to? And I would ask that you actually kind of divide this question in two, because you mentioned business interruption insurance earlier, and certainly that is a hot topic still with the pandemic. We're watching very closely active lawsuit case up in Chicago to see what happens with that. A group of restaurants that have gotten together against their insurance company may set a precedent that hopefully would have a positive outcome and mean a lot to a lot of people who had very valid policies without any kind of outbreak rider on it. and should have gotten a payout and didn't. So, it made a lot of people raise an eyebrow and say, okay, insurance, is it good? Is it bad? And you've got both the business interruption and the food outbreak insurance. So what have you seen as far as trends and people kind of giving it a second thought?
So funny enough, I actually, there's two main things that I insure. One is restaurants and one is insurance agents. So I got the best of both worlds when it came to the pandemic. So I think first and foremost, I have to state that you have standard business interruption policies, which have been around for years and years and years. And they've always been based on direct physical loss to your location. So that means you actually have property damage that causes you to either shut down or people, lack of ingress, egress issues. And that's your typical, what we call standard business interruption. And then you have what we call contingent business interruption. And, both fortunately and now unfortunately, we actually sold contingent business interruption coverage that covered the pandemic. So we paid losses to restaurants who had purchased that policy. There's not a ton of carriers in the marketplace that write contingent business interruption for restaurants. We are one of 4 markets. And we've all done it for foodborne illness for sure. We call it contamination. It's your biological, physical, and chemical contaminations. But so that's always been, and when the Ebola stuff started back in 2012, I believe, that's when the pandemic coverage was actually developed. And so it was available. And now post-COVID, unfortunately, there are no carriers that are willing to write it anymore. So everybody's taken that out of their policy. There is one exception. I have a partner in London who is willing to write it, but it's only for larger companies who can take large, deductibles and have, it's really for the large franchisors is what it's geared towards. So fortunately, some restaurants did have the protection and were able to, get at least, it was a sublimited amount, but we're able to get some financial assistance to help them along. But unfortunately, it's just something that's not available anymore. My goal ultimately would be that we create something that would, make future pandemics, insurance for future pandemics make sense to both businesses as well as insurers. But, when we're in the midst of COVID, it's not really going to happen. So, the question is, do we have people coming to us? Absolutely. Every day I have people coming to me, and it just, it really breaks my heart to have to tell them it's not available anymore. But you have to think outside of COVID too, right? You have to think beyond it, because there are exposures that you face in your business every day that you're not protected for if you're not carrying this contingent business interruption policy. And again, we go back to, you have to decide, what am I willing to invest in my business to make sure I am protected financially when these things do happen? Again, it goes back to the reason for not purchasing, that it's never happened to me. Just, that's not a good enough answer. It's just not. And so, yeah, again, and I'm watching the lawsuits develop on the insurance agent side for sure, as well as following the national ones that we're seeing in the media for sure. So we'll see how those ultimately turn out. There's a lot of different legal theory that's behind it, but we won't get that deep into it.
Fair enough. Adrian, a question from Henry Perez. Certainly we know that a lot of people have actually taken the advantage while furloughed to say, okay, my certification is going to expire soon, I might as well re-up it. There's only so much Netflix and chill one can do. But as you've been teaching the classes over the last 5 months, have you seen more people take the training a bit more seriously and kind of perk up more and say, okay, now's the time that this isn't just something you sit through 8 hours counting the clock down and how fast can you get out of that room?
I have. Actually, it had changed a lot, and I've been busy certifying managers, food handlers, but it has increased. Now they pay more attention to it. You have to know too, I'm fully bilingual, so you gotta understand cultures too. That's another one, okay? So, and then whenever they come over to, they understand where all these things coming from, all these food codes. Why do we have this class? Why is it mandatory? It's, everything is based out of the FDA. The FDA, the Food and Drug Administration, it's a government agency that serves as a model for the whole United States for them to follow. It is important. I see the interest on it now too. When teaching the class, I actually certified about 5 ISDs last week, because the training is very important and make sure they understand it. And you got to be able to answer the questions too. Whenever a customer asks you, a manager asks you why, you got to have the answer for it. And it's got to be, that's what we study. And we continue study and reading. When all this happened, I didn't stay home and just sit down and watch TV. I went in there and I started taking another course that I needed to take. But they are paying more attention to it. And I think they understand how important it is now. As I mentioned, viruses they don't grow in a product. They introduce to it. It's a virus. It could be introduced into a piece of hamburger meat, poultry, but also a plate, a fork, a knife. We contaminate a plate. What do we put in the plate? We put food. Then it goes in what? Human consumption, right? That's another one. Bartenders too as well. When I'm doing a special, I go, don't grab the tequila bottle, serve a drink, and then put it right there in the ice, and then you scoop an ice for a drink. That's you contaminating. All these things are very important. Where do they come from? Where do you see all these things on your T4 Texas Food Establishment Rules? It's in there. So yes, they're understanding more, and it is more important. I'm very happy for that. I'm very happy when they attend the class. I always mention at the end, make sure you practice all this when you go back to your food establishment. Take care of the customer. Yes, absolutely.
Perfect. Chris, a question for you that I think everyone would find of interest, and this is kind of both from the health sanitation side of things, but also just kind of in general where our industry's gone, and it's come to the forefront during the pandemic. Our family was still in business as the Yelp, Google survey review generation emerged. And it wasn't fun by any means. I'll take a professional food reviewer any day over community opinions on social media. But the texting service that A Closer Look provides is part of the secret shopping. The customer themselves know then that their voice is going directly toward a manager or the owner. And we very early on saw just how impatient, how lacking in empathy the general public was being towards restaurants, and called out for there to be just a little bit of grace in that. Yeah. As people were changing their business models literally overnight to do curbside, to take what was always a nice to have cherry on top of the P&L, delivery or takeout. Yes, some businesses had it as a significant part of their revenue, but let's be very clear. On the whole, unless you had a drive-through lane, most restaurants, it was a nice to have. Yeah. And oftentimes, like on a Saturday night, and a nuisance that you would sometimes pick up the phone and say, yeah, sorry, we're not doing takeout orders tonight. And now it is very much an essential revenue channel of a business. And I think one of the things for the future that we will always see is businesses looking to establish and keep permanent a focus on that being a very significant channel of revenue for their businesses. Mm-hmm. So they're worrying about doing all of that, and people are getting annoyed waiting an extra 5 minutes for that food to come out the door and everything. So from the consumer side, the data that your company gets to see, is the quality of the feedback, is the interaction more genuine, more truthful, more positive in its outcome? Or is it just one more platform where you're getting the Yelp-esque review, and as an owner, you want to just kind of go take a pot or a pan in the kitchen and throw it against the wall? And letting my Sicilian out a little bit here, but you get where I'm going with it.
I do, totally. And look, so I've been in the customer service business for 30 years, and I can tell you that the way most companies collect customer feedback really hasn't changed much. Social was the newest thing that came on many years ago. The problem with that, and I'll be bold and say it as somebody who's run big organizations, I hated social media. It was the worst, And it really was only those individuals that were looking for something for free or wanted to complain. And a lot of it was really misinformation. And we've lived with that for, many years. What's interesting about what COVID's done is I think it's done two things in the social media space. It's just perpetuated how bad social media can be, whether it's Yelp or Google or whatever. And people aren't very nice. And a lot of times right now, they're spreading more misinformation. There's already a lot of misinformation about COVID and state standards and city standards. And so we saw that early on, and we said something's got to change with that. And what we're doing is, look, people want to give feedback. They really do. They genuinely want to give feedback, but they need a better vehicle to be able to do that. And they need one that provides the business with some fairness. And so our program, not to sell this, but our program is really, we've found a way that the customer can text their feedback directly to the business. It's private, it's discreet, it's easy. There's nothing easier than text messaging. And it allows the business to get that information quickly and be able to act on it, whether that's fixing something operationally that's happening in the location, or turning a detractor into a promoter by reaching out. I mean, when was the last time you went on social media, complained about something, and somebody actually contacted you? It very rarely happens. And so we believe that the path forward is giving the consumer the right way to give you the feedback that's necessary for you to make changes. And we think the program that we've put in place will actually do that. I'll be bold, Joe, and say I think what we're seeing right now is anti-social media movement. I think people are getting really tired of the Facebooks and the other things because you got to be so careful about what you say. And I think the customer's craving a new way to be able to give business feedback. And we think this is the answer.
Fair enough. And I think Henry Perez agrees with you as he comments, if it's on the internet, it has to be the truth, doesn't it?
Yeah, exactly.
Well said, Henry. So a question, just kind of going back to what I was saying a minute ago about carry out, delivery, curbside pickup becoming a permanent and important channel of revenue for businesses as the operational model, I think, kind of permanently shifts the paradigm moving forward. Adrian and Crystal, I think these are things that are going to come up if they haven't already as we move forward. And they kind of need to come from two perspectives, both the insurance perspective, but also the health department and inspections perspective. So as we go forward, there's been this, everyone developing their own approach along the guidelines, as you will. But we've got some very interesting models that have developed where you can place your order, you pull into a parking spot, it's got a number there, you send a text message with your spot number and your order number, and they show up and boom, your food's dropped in your car, and it's totally contactless. And from the person-to-person contact side, it's very, very smooth. But from how the health department's going to look at it, and then from the foodborne illness and insurance side of it, when you talk about things like transfer of responsibility and that exchange from hand to hand, and things like the type of containers used and packaging and the bags. And let's not forget that before this whole pandemic, we were still living in a world where reusable and recyclable and thick paper straws instead of plastic was the end thing, and all of that going on. There's definitely going to be this higher focus on to-go and carry-out and how it's done. So what are the things that operators need to watch out for? What are the things that maybe right now a lot of focus is not being given to because of the pandemic? But we know that within maybe a few weeks, within maybe a few months of the end of the pandemic, as these types of operations continue, there's going to be attention given to them. And then it's only just a matter of time before something happens of a foodborne illness nature. And then it's an even bigger issue and it hits the news, and it's, to Adrian's point earlier, the next Chipotle. So, Adrian, why don't we start with you from the, what people need to be thinking about from that safety and sanitation perspective. And then Crystal will go to you from, again, the insurance and the transfer of liability, and either of you please weigh in on the whole idea of the packaging and how it's used and all of that. So Adrian, we'll start with you there.
Absolutely. Actually, I was in a meeting with the GDRA back in February, and the meeting, this is before COVID, it was about DoorDash and Uber delivery, all that. one of the things that I found that not some drivers has to do with personal hygiene, coming over to the restaurant and picking up food. The personal hygiene is not that well. Their vehicle too, that's the other one. And then the other thing too, they're tampering with food. They either missing some fries, or they took a sip of the drink, or they missing an order of tacos, they're missing one. They're food tampering. And I was mentioning in that meeting, the restaurants, for some reason, I mean, we asked the dishwashers, we asked the cooks, we asked the bartenders, anybody that's serving or cleaning or touching clean equipment to be certified. But yet this delivery people that come over and get food, they're not certified. So through TIHA, Texas Environmental Health Association, I had a conversation and I said, why can't we put a bill in the Senate to make it mandatory for them to be certified? And also, I also mentioned to the restaurants, you protect your product, seal it, you do it, make sure they don't break that seal. Look, all of a sudden back, I think it was in March or April, when I think it was in April or May, when Pizza Hut started putting a seal to the pizza box. I thought it was great. I thought it was amazing. I said, great. Now everybody's stepping forward to containers, seal them before they go, before they leave your food establishment. If they bring a container to you, you got to wash, rinse, and sanitize properly yourself before you trust that person that brought it to you. There's going to be wash, rinse, and sanitize properly. Because at the end of the day, when that food tampering happens, maybe by a driver or somebody else, they're going to blame the restaurant. They're not going to blame the driver. That's why I was asking this companies, Uber and Dash, DoorDash and all those, to get them certified. I actually offer, I say, I can create a class for you for these drivers. I mean, it's not going to be a valid or an accredited body by the state, but eventually it will. So we're working through TIHA right now, and hopefully we'll write a bill, but it's going to take a long time. It's going to take about a year for it to pass, and I hope that it does pass, where this delivery companies can get certified properly and don't do this food tampering. But the advice I can give to the restaurants, seal everything. Protect your restaurant before he leaves right there. If you don't feel comfortable with that driver, which is don't, call that company and say, send me another driver. Okay, personal hygiene and all those things are very important.
Well, it goes right there with the way our alcohol to go waiver was done.
That's right.
Yeah, you can send a mixed cocktail or margarita out your door, but it's got to have tamper-proof sealing, so it's been wrapped, bagged, zip tied. You're the one who breaks that seal when it gets to the house, or
That's right.
Lord knows how many sips it's been had by your delivery person on the way home.
And also on the drinks, when it comes to TABC, well, if it's one person, you got to check their ID, obviously, and they can order 5 drinks, 5 margaritas, right? But if it's 4 people in the vehicle and they order 4 margaritas, you still have to check ID on them.
Mm-hmm.
Yeah, I would add to that too. Don't rely on the third-party service surveys either, because I know some of them provide surveys and say, look how well we're doing. Make sure you have a way to independently survey your customers that are receiving your product through those third parties. Mm-hmm. When you do that, you might find some very interesting things.
Yeah, absolutely. So Crystal, from the insurance side of things, especially right now in this world where we're really encouraging contactless handoff, et cetera, where does the transfer of liability then take place and all of that fun stuff?
Great question. So in the world of cargo insurance, we have this thing where it's whoever's holding the product is who's liable for it, right? Basically. So if I'm the trucker, I'm driving the cargo, as soon as I drop it off at the warehouse, they sign it that they've accepted it. It's now their liability. Unfortunately, right now, we don't have that kind of sign off happening, right? We don't have these drivers who are working for third-party companies signing off that they're accepting responsibility for any type of liability or anything affiliated with that food. So that's a really big issue. And I could go on for this about hours, but with the liquor liability issue, I see a huge exposure here. I think it's fantastic that Texas has finally moved on beyond our blue state law, or our blue state laws, where we had the or what did they call them, is the blue laws, where we had all the dealerships can only be open one day, that kind of thing. And I thought it was fantastic that they provided it, but we haven't thought back. Are you guys having customers sign any kind of waivers stating that, they're not going to be drinking and driving? Are you having them, when you send them away with that gallon of margarita, even though it's technically sealed, are you having them sign off that they're not going to be the only ones drinking it? If they were sitting in your restaurant, would you serve a single person that entire gallon of margaritas? So you're looking at alcohol poisoning issues. There's a lot to be said there. But going back to the packaging and the prepackaged food, so there's a handful of things. One, there's the food tampering, obviously, that can happen, right? So you have your biological, chemical, and physical contaminations. Biological is all your stuff that has to deal with foodborne illness. It's your Salmonella, E. coli, norovirus, Hep A, etc. Then with your physical and chemical contaminants, I mean, we've seen plenty of issues where a worker will put cleaning compound on French fries on, some rude teenagers that are coming through the drive-through. And so that can happen with those drivers. It's more than just them, yeah, they can take a bite of a fry or whatever, but it's about what are they putting into the food? Are they spitting in it? Are they putting any kind of other things in the food? And so I think, Adrian, you brought up a great point. Sealing those products is fantastic. The other thing I would warn people about is, as we were prior to COVID, in this whole situation of everybody trying to be more environmentally friendly, and what are the things, how can we get rid of single-use plastics and styrofoams? And I've seen people use food grade recycled material for packaging, which is great, but make sure your contracts with your suppliers are very strong in that, because we have had issues with that recycled material when it's food grade. It could be something as simple as there being an odd smell coming from it once the food is added. We had an issue with pizza at one point, and it was because of the heat. It caused a chemical compound within that recycled material it wasn't harmful, but it did put off an odor that therefore made people concerned. It hit the media, it impacted the brand, right? And I think the other thing that I'd like to really bring up to people is actually outside of foodborne illness. So we're moving to this whole scenario of online orders and food delivery or pickup. And number one, I do see a lot of restaurants trying to find a way to go outside of the Uber Eats and stuff and do something that's on their own. But you have to think about two things. One is cyber exposure. So that is data that you are collecting. And even if you are taking orders over the phone, you take an order over the phone and you take down somebody's credit card information, that is an exposure right there. That is, we call it cyber because we think digitally so much now, but even that's customer sensitive information that you're collecting and that could be stolen and therefore you're responsible for. But I think it was something like in March, as a result of COVID, there was something like a 600% increase in ransomware or in phishing scheme attacks for companies. I mean, the cyber exposure is absolutely blown up. So if you're using any kind of online platform for any kind of ordering, you need to have some type of cyber protection in place. And the other one is if you're utilizing, whether you're utilizing a third-party company or you're utilizing your employees, is hired and non-owned auto coverage. So if you send off an employee to make a delivery and they're driving their own vehicle, their auto policy is not going to pick up coverage for that if they have an accident. You have to have hired and non-owned auto coverage in place. And that is absolutely 100% imperative. So, again, three things with insurance for the unique things, the unique exposures that restaurants are facing. It's going to be your cyber, your hired and non-owned auto, and your contingent business interruption.
Perfect. Thank you. I know we've gone over by a few minutes. We're going to do a quick wrap up here. One thing I do want to add to the topic we have been discussing, and as always is the case, how we keep our restaurants clean, health and sanitation. It does permeate all aspects of the business, and the things that we're doing to change our business models are impacted by it as well. When it comes to the alcohol waiver that's currently in place, there are steps that employees have to take when they put alcohol into a car. In the gallon example that Crystal gave, it is considered more a retail sale than it is serving one person a gallon inside of a restaurant, which we wouldn't do. As we go into the legislative session in January, we hope to make that waiver permanent. I'm sure there will be other pieces that go to that. Our training piece that's in the Texas Restaurant Certification Promise Program does teach to that right now. And so a lot of these pieces will become permanent pieces of either how food service certification training is done, or the TABC to Go program will get updated accordingly in the future. First, we got to make this law. So that's step one in January. I want to thank our three panelists for being with us. I want to give them each a quick chance to leave you with one last piece of advice on how to think about sanitation and health inspections and safety in your restaurants as we continue to traverse this crazy pandemic world that we're currently in. So we'll go in reverse order as we did with introductions. So Chris, one last piece of words of wisdom and advice for our attendees.
You know, I would tell everybody to keep fighting. I think that's really what it's all about now. Be adaptable, do what you can. Think about every customer that walks in your door as an opportunity to rebuild trust and brand loyalty. Make them feel comfortable, because if they do, I guarantee you they'll come back.
Perfect. Crystal?
Thank you. Thank you everybody for joining. And I guess, you know, from my perspective on insurance, just our world is ever changing, right? I mean, this pandemic has made that statement vastly true for everybody. And things continue to change. From an insurance perspective, our industry within insurance is changing rapidly as well. And while standard business interruption policies continue to be available, and I expect them to continue to be available, you know, there could be some changes with you know, the policy form depending upon how lawsuits work out. I noticed somebody had asked a question regarding, you know, how does that impact new restaurants trying to seek that standard business interruption coverage? You could be paying a higher price because rates will go up as a result of the claims that are having to be paid. But the biggest piece of advice that I'd like to leave everybody with is just please think broadly, have a deep discussion, be willing to, you know, have those deeper discussions with your insurance agent and talk about that, you know, here's things I never thought would happen to me, and here's COVID happening to me. What else have I not thought of? It has to be a collaborative effort. Gone are the days where we can accept auto renewals. Gone are the days where we can just sit there and just never mind our insurance. We're just going to write the check and renew it per expiring. We can't do that anymore. We have to sit down every year and consider, has our world changed? Has our business plan changed? What's changed within our operations that has heightened our exposure in these certain areas? And if it's okay if your agent isn't an expert in foodborne illness, that's fine. Find someone who is. They can still write your standard lines of business. I'm sorry, pretty much any insurance agent can write your property coverage, can write your general liability, but these unique lines of coverage, you need an expert in. You know, so I strongly suggest you get somebody who's an expert in those areas to work alongside you with your agent, you know, and help you through that process. But really, you know, just be involved and be present when it comes to your insurance.
Great. Thanks, Crystal. Adrian?
Well, the advice I can give is care for your customers. Care for them. They're the one that coming over to your restaurant. Care for your employees. Care for your food establishment. This is your dream. This is your investment. But you got to know how to do all those things when it comes to food safety. Get the proper training. Yes, do we have the food handler online and TABC online and the food manager certifications online? We got them. We do. But you got to be able to understand it. And you got to be able to practice all those things. Because look, just earning a certificate, getting a certificate, and you show it to the health inspector, and you have no food safety knowledge, and you're not practicing food safety either, because some of them will buy it, or somebody else will do it on their behalf. Well, guess what? The health inspector can actually go take another class. That's law on your TFER, Texas Food Establishment Rule, Law 228.32. They're able to ask you, go take another class so you have no food safety knowledge. Just don't play with food. Somebody can get sick. Get the proper training. Look, bring me in if you want to. If you want, I won't charge you to go into one of those meetings. I can go into one of the meetings if you want. And we can do, I can participate for 10, 15 minutes, explain, because I know it's different. There's a difference whenever a chef explains something versus a health inspector. This is why I've done at the American Airlines Center, doing the inspections in there, because that's what I do. I'm not a chef. I'm a health inspector in that venue. So there are laws involved too. Like I said, your FDA and your TFER. Just get the proper training, practice all those things daily, break the bad habits from the good habits. Because I've seen it too. I've seen it where cooks, they've been there for 10, 20 years, and they said, I always done it this way, or the health department, they tell me that. You got to understand too, when it comes to city ordinance too. Is it this city ordinance they got to sign off? You know, the state of Texas says 135 is your household. Well, Plano says 145, but that's a city ordinance too as well. Just get the proper training. As I mentioned, we are going to be doing this trainings too via Zoom too. We'll at the end of August.
Great.
Good luck.
And a generous
Enjoy.
offer. Thanks, Adrian. Again, thank you all for joining us. That wraps up our health inspections and on-site visit session. Thank you all very, very much for taking the time. Apologies for going a little bit over. This was also the last session for today. Join us tomorrow for day 3 of our 6-day virtual TRA Marketplace. We've got our live stages going on, the PAC sessions happening. If you haven't already joined the PAC, go online. You can get access then to the PAC Lounge. And I want to just thank again, Crystal, Adrian, and Chris for joining us and being part of this session. And Ariel, I'll turn it back over to you.
Thank you.
Awesome. Thanks so much, Joe. And just like he said, thank you, Crystal, Adrian, and Chris. You guys are awesome. And I know Joe touched on this, but tomorrow at 10 a.m. on this virtual stage, we will have the next demo, and it's going to be packaging for 2020 and beyond. So be sure to come here at 10 a.m. tomorrow. We'll see you guys then. Thanks, guys.
Thank you.
Thanks,
Bye-bye.
Ariel.
Thank
Bye,
you.
y'all.
Bye, y'all.